Welcome to Mayo Clinic Q&A. I'm Deb Balzer. As stay-at-home restrictions ease around the country, you might be wondering what activities are safe and how you and your family can visit places and still protect your health. Joining me today is pediatric infectious diseases specialist, Dr. Nipunie Rajapakse. Dr. Rajapakse, how are you? And thank you for joining us today.
I'm well, Deb. Thanks for having me.
As people are getting ready and eager to start their summer plans, how do you assess what is safe with some of the things they might want to do?
So this summer coming up is going to be unlike any that we've had before, and I know people are trying to make a lot of really difficult decisions about what kinds of activities they might participate in over the summer. I think as a general rule of thumb, there's kind of 4 dimensions to different activities that we would encourage people to think about as they try and decide whether it's something safe for themselves or their family to do. And that relates to 4 things: time, space, people, and place. And I think using that rule, you can think about a few things that might help you determine the risk of certain activities. So for example, if you think about time, shorter activities generally will have a lower risk associated with them. So if we take the example of a restaurant, going to get curbside pickup or takeout from a restaurant will have a lower risk associated than having a long 3 or 4 hour sit down meal at a restaurant. The other dimension is space. Wherever you're planning to go, how much space will you have around you and how much control do you have over that space? As you know, we've been recommending the 6 foot of distance based on the droplet transmission that COVID is spread by. And I know, for example, in a restaurant setting, many restaurants have taken precautions to move their tables 6 feet apart so that you're not in close contact with people. So looking at aspects of space are really important when it comes to transmission of infection. People refers to how busy the area is. If there's a large crowd of people, your risk of getting infected is going to be higher than an area where there's few people or no one aside from yourself and your family. And so if you walk into a restaurant and it's packed full of people, that is probably a high risk setting and you probably want to avoid places like that. Place refers to whether the activity is taking place inside or outside. We know that transmission is much less likely to occur in outdoor settings. So if you go to a restaurant, for example, and you have an option to sit out on a patio rather than inside the restaurant itself, that's another decision you can make to reduce your risk. So those 4 dimensions, time, space, people, place, I think can be a tool that people can use to assess risk in any situation that they're thinking of.
So let's go over some of the activities that are very popular, and perhaps you can help me. So you talked about restaurants. So what I'm thinking is that if you're going to a patio this summer, it might be much better than eating al fresco, for instance, much better than going into an indoor situation, for instance. What about drive-through? Is any concerns about going through a drive-through restaurant?
So going through drive-through is considered low risk. We know that this infection is primarily transmitted by close contact between people, and your contact with a person in a drive-through is relatively short and relatively distant. It is possible to pick up the virus off of a surface, so that's why we are still recommending everyone practice really good hand washing. But that route of transmission is now felt to be much less likely than being in close proximity to someone. So we would consider getting food at a drive-through to be a relatively low-risk activity.
Food is a big deal for us. We eat every day, but barbecues, potlucks with our family. What do we need to be thinking about as we do these or want to do these activities this summer with our friends, families, and so forth?
So that's a great question. Thus far, we have no scientific evidence to suggest that the virus is spread through food itself, which is good news. So the risk of those types of activities really comes from being in close proximity to others. So if you are getting together with neighbors or friends, your risk of getting sick really comes from being around other people. That's why as people consider kind of expanding their social circles over the summer, one of the things we're recommending is to pick 1 or 2 friends or family that you consistently will spend time with and that you trust are also doing a good job of their own physical distancing, rather than doing something like hanging out with a different friend or family every night of the week. This reduces the risk for all of you in that group. And if someone were to get sick within that group, would make the risk of transmission much lower overall. When it comes to potlucks and barbecues, one of the risks is common surfaces and utensils. So if everyone is serving from the same dish using the same spoon, that would certainly present a possible risk of transmission of infection from person to person. So as much as possible to have individual servings of food, to maintain physical distancing, to have practice good hand washing and wiping off surfaces will help to reduce the risk of those types of activities. And we would still recommend limiting the sizes to as few people as possible.
Would wearing gloves help in a situation like that? If somebody was a server, would wearing gloves be any help?
So really, gloves are no substitute for just really excellent hand washing. Sometimes wearing gloves gives people a false sense of security. And if they pick up viral particles on the gloves and then go on to still touch other surfaces, they're still transmitting virus from surface to surface. So just really good hand washing and being very mindful of what you're touching and washing your hands often is often safer than wearing gloves.
Great points, Dr. Rajapakse. One thing we love to do is go camping in the summer. Any thoughts about packing up the kids, packing up the family, and heading to a campsite?
So with camping, the risk really depends on where you're going and what kind of camping you're doing. So if it's yourself and your family in a tent and there's no one else around you, the risk of that is obviously extremely low. But if you're going to a campsite where there might be shared facilities like outdoor bathrooms or a lot of people that are camping in close proximity to each other, or again, kind of sharing of food and other things, your risk would go up during situations like that. Certainly being outside helps to reduce that risk. There's a lot of dilution of the virus that happens out in open air, and virus gets dispersed in wind and other air currents, which decreases the chances that someone will get infected outside. But the safer options for camping would involve those where you have a lot of space around yourself and your family and your campsite and are not really coming into close contact with a lot of other people.
Dr. Rajapakse, there's a lot of questions about traveling, whether it's traveling across the state, traveling across the country during the COVID-19 pandemic. Let's start by thinking about car trips and traveling long distances in a vehicle. What are some of the things a person or a family should be mindful when taking on a long car trip?
So I think when you compare the risks of different modes of travel, a car trip would definitely be lower risk than something like air travel or train travel. I think there's a few important precautions that should be taken. Firstly, it depends on where you're going to or what your destination is and the areas that you're going to pass through. We still have quite variable community transmission in different cities across the United States. So it's really important to look to see what's going on in the places that you will be. And usually the state or local public health website will have information about current risks in those areas. When it comes to car travel, probably your biggest risk, as long as you're traveling in the car with other people from your household only, would come from making stops along the way. So if you're stopping at a gas station, stopping somewhere to get something to eat, those would be kind of the highest risk periods of time in your trip. And we would encourage people to try and minimize those kinds of stops as much as possible, keeping in mind that obviously it's very important to get adequate rest and take breaks if you're driving long distances for other safety reasons. So packing along snacks and food that you can take with yourself might help to reduce the number of stops along the way. And then certain things like using hand sanitizer, washing your hands well after you pump gas if you're touching the gas pump, or if you're using public restrooms in a gas station or something like that would also help to reduce risk further.
What are the concerns or risks or benefits of taking air travel during this time? Is that something people should be considering getting back on a plane, or what things should we be talking about right now we're thinking about?
I think there's a lot of different kind of aspects to the entire process of air travel, from when you set foot outside your door of your home to when you arrive in your destination, that people need to take into consideration. And I think there's still a lot of kind of unknown variables or risks that make air travel relatively risky depending on where you are and where you're going. I think some of the unique things related to air travel include being in an airport where you might have people from different places that are congregating, and some may come from areas where there's higher risk of infection. A lot of common surfaces at the check-in desk, going through security, at the gate, and then obviously on the airplane itself in terms of high-touch surfaces like your seat back tray tables and seats and aisles and things like that. And so I think all of those pose their own unique risk for transmission. Obviously on an airplane, it's very difficult to maintain that 6 foot of distance. I know many airlines have implemented policies to try and do this as well as you can on an airplane. But again, you're likely to have be in contact with people that are within that radius from you. Many airlines have instituted mandatory masking, which I think is very reasonable to do. That will decrease the risk somewhat. But again, none of these things alone decreases your risk to zero. And so definitely air travel still carries some risk of transmission of infection.
Are there things that a person can do to help reduce some of the risks they may face?
Yeah, so some people will have to travel for reasons that are kind of inevitable, and I think there's a few things for sure that they can do. Number one, if you're feeling ill, we would really recommend that you do not travel. That's a very high-risk situation, and you risk exposing many other people. Definitely wearing a mask protects you from spreading infection to others. There may also be a small benefit to yourself as well. Trying to maintain physical distancing as best as possible. So keeping that 6 foot radius around you is also critically important when you're traveling or going through areas where there might be many people as well. Using a disinfectant wipe to wipe down high touch surfaces in your seat area as soon as you sit down can help to decrease the risk of picking up any virus that may have landed on those surfaces from people who may have traveled before you. And turning on the fan above your seat can help to kind of increase air circulation and reduce the risk that if someone coughed or sneezed near you, that those virus particles may make their way to where you're sitting. And then obviously just excellent hand washing and hand hygiene from beginning to the end of your trip will also help to reduce your risk of getting infected.
Hand washing helps with everything, doesn't it?
Yeah, so we're obviously talking a lot about COVID right now, but there's lots of other types of infections that can be transmitted or acquired during the process of travel, and hand washing will really help to decrease your risk of picking up any of those things.
One thing I wanted to ask about, we like to swim in the summer. Is going to the beach, or is it less risk to go to the beach or to a swimming pool when it comes to COVID-19, or are they about the same?
So I think the answer to that really depends on how many people are in the area. I don't think by virtue of salt water or chlorinated water, there's going to be a huge difference. The virus is quite easily inactivated by chlorine or other dilutional agents that are used in a swimming pool. So it really has to do with how many people are there. A crowded swimming pool will be still a risky place. A crowded beach, similarly, as risky. So I think just trying to avoid being around too many people is really the key for when it comes to beaches and pools.
Thank you. We're talking to Dr. Nipunie Rajapakse, a pediatric infectious diseases specialist at Mayo Clinic, and we're talking about kids. All these activities include our children. And what do we know, doctor? Is there anything new that we can share, that you can share with us about COVID-19 and children?
So Deb, as we've talked about with kids thus far, all of the evidence continues to show us that overall children, when they do get infected with the virus, tend to have mild, moderate, or asymptomatic even illness. So they may not have any symptoms at all. That has still kind of borne through as we've progressed through the pandemic. However, more recently, we have learned that that does not mean that kids cannot suffer any significant sequelae from this infection. There have been children who have died from the infection, thankfully only very small numbers. And then in the last month or so, we have learned of a new syndrome that is affecting children, most of whom have evidence of prior or recent infection with the SARS coronavirus type 2 that causes COVID. This is a condition called multisystem inflammatory syndrome in children that we're still learning a lot about, but that has caused quite a bit of concern amongst medical communities, especially amongst those of us who take care of children, and I know has caused concern for parents and families as well. Thankfully, This syndrome has been rare, but it has been reported in many different countries around the world, especially in parts of Europe, and we have definitely had cases here in the United States as well. And our understanding of it thus far suggests that this is an illness that can occur in children, not necessarily related to the time that they're infected with the virus itself, but is likely, we think, an immune system response that happens after they have had the infection before. And so these children are presenting with a variety of symptoms, usually fever. Many have had gastrointestinal symptoms, so things like abdominal pain, vomiting, diarrhea. They can present with rashes, redness of their lips and tongue, swelling, and changes involving their hands and feet. And so we're still learning a lot about this condition, but it's something that can be very serious and that we're trying to understand more about.
Is there treatment for this, doctor?
So thus far, because this is relatively newly described, the management for children who are presented with symptoms like this and who have been given this diagnosis has been extrapolated from another condition that we are familiar with in children called Kawasaki disease that shares many similar features to what we're seeing with MIS-C. The treatment involves use of an antibody product called IVIG, or intravenous immunoglobulin. So it's a pooled blood product that takes antibodies from lots of different people and has a very significant anti-inflammatory effect. So one of the characteristics of this syndrome is inflammation that affects many of the different organ systems. And so IVIG has been shown to be quite effective in shutting down that abnormal inflammatory response. And many people have also combined this with use of steroids as well, usually given through an IV. And that combination of treatment so far has seemed to be quite effective, especially in the cases where children have been diagnosed early and received treatment early on in the course of their disease. There are certainly many children who have required care in intensive care units because at the more severe end of the spectrum, kids have developed issues related to their heart function and extremely low blood pressure and other worrisome symptoms like that. And certainly the sooner those children are treated, the better their outcomes seem to be as well.
We've been talking with Dr. Nipunie Rajapakse, a pediatric infectious disease specialist at Mayo Clinic. Thank you for tuning in, and we'll talk to you next time. Thank you.